Well, good afternoon, and thank you for your patience. My name is Lori Gramlich, and I proudly stand here before you today as the City of Portland's Public Health, Family Health Program Manager. I couldn't be more excited. We're here not only today to unveil our newly renovated school-based health clinic, for which we're very excited. I feel like it's Christmas. I mean, this is just fabulous. But we're also here to dedicate our health center in honor of our good friend Amanda Rowe. We're very appreciative of our grant that we received from HRSA, the Health Resources and Services Administration, and the funds that were appropriated through the Affordable Care Act to make this possible. Amanda was a friend, an advocate, and an ally. As a nearly 30-year veteran as a Portland Public School nurse, she was undaunted by obstacles and controversy. She consistently and courageously advocated for public policies to protect the health of our children and other vulnerable populations. Through her actions, she inspired others, myself included, to act. I keep a photograph of her on my file cabinet, and every time I have a question, I think about it and I look at her. I'm proud, honored, and humbled to be part of something bigger today that has such a powerful and positive impact on our children and for our future.
I've been involved with school-based health care for a number of different years, and the unfortunate truth is that oftentimes the only health care and the first line of health care that children receive is within these schools and with these school-based clinics. So thank you very much for the work that you've done, Lori, and everybody else in HRSA in order to make this happen. I obviously have to tell you a couple quick stories about Amanda Rowe. The first one is that one time I was over at her house visiting Steve, and she came up to me and she said, Mike, will you introduce a resolution about X, Y, and Z? And I said, Steve, I said, Amanda, I said, your husband is Speaker of the House. I said, well, why are you coming to ask me to introduce, a proclamation? And she said, oh, I can't get him to do anything. And the simple fact of the matter is, I knew that wasn't true either, because a lot of the good things that Steve did, he did on his own, but many of the good things he did were because of Amanda and the influence that Amanda had with Steve. But this is one thing I do have to tell you, I don't know if you'll arrive at the same conclusion that I have. But for many years, I did go over to Steve's house, Amanda's house, to talk about politics or whatever else we were talking about. And every time I'd go over, Amanda would immediately say, well, Mike, you didn't do this, or Mike, you should do this, or Mike, why didn't you do this? And I was on the education committee, and then I chaired the education committee, and she was always complaining to me about something I wasn't doing or not doing. And I said to Steve, I said, Steve, I said, is she like this with everybody? And Steve said, oh, Mike, that just shows how much she likes you by doing that. So I'm here today for the first time to say that I am the person that Amanda Rowe liked the most in Portland, because there's nobody other than Steve that I think that she spent more time complaining to about all things I could be doing or should be doing. And so I'm very happy to be here and to be part of this event and to name this health center in her behalf. And I also know that if she were here, that she would be immediately contacting the governor and contacting the legislature and say, pass the Maine care expansion. And that we have too many people in this state that don't have access to health care, and they need access to health care, and that passing the Maine care expansion will allow 70,000 people to have access to health care. So I think all of us should renew our efforts working with the legislature and with the governor to make that happen. And finally, and maybe most importantly, it's important for us as a community to leave a legacy of examples of people that represent the best of our community. And that's what we're doing here today, is that we're giving honor and leaving a legacy of a person who represents our values and our community. And that legacy is now going to be carried on to the next generation. And that's why it's so important for us to be here and to participate in this dedication and to remember Amanda Rowe.
How fitting is it that we're here today to name the newly renovated Health Center Portland High School after Amanda Rowe, a longtime nurse in Portland Public Schools and a leader in advocating for children's health. Amanda worked as a nurse at Hall Elementary School for more than 20 years. She's always made students and families feel comfortable and respected as she talked with them about health issues. And she did whatever it took to deal with the problem at hand, whether it meant cleaning off a scraped knee or accompanying a child to the emergency room. Amanda served as a nurse coordinator for Portland Public Schools for several years. She helped the district handle health issues such as preparing for potential flu epidemics, to successfully advocating for the installation of defibrillators in every building. And she also spoke out strongly in support of school-based health centers. And although we still mourn the passing of Amanda, we know that her legacy lives on, not only in our hearts, but will live on in this clinic, where all Portland High School students will have access to a full range of health care services, regardless of their ability to pay. We are grateful for the federal government that paid for the renovation of this clinic. Thank you to the City of Portland, Public Health Division for working with the school district to provide healthcare services to our students. And most of all, we're grateful and thankful to Amanda for her compassion, her courage, and for all her efforts on behalf of Portland students. Thank you.
I would like to introduce the chair of Portland School Committee, Sarah Thompson.
Thank you. I'm excited to be here today for the official ribbon cutting of the newly renovated Portland High School-based health center. As you may be aware, the centers are currently housed in 5 of the Portland Public Schools: Deering High School, Cascoba High School, King Middle School, East End Community School, and here at Portland High School, but are operated independently from the schools. My dear friend Amanda Rowe once said, "The school-based health center has a special relationship in the schools." The school department couldn't agree more. We consider the health centers a vital partner in keeping our students healthy and learning. For a number of our students, the school-based health center is their primary care, where they receive their comprehensive health care. The clinic sees all students with little interruption from the school day. Amanda once provided her perspective based on her work and said, "When we first brought the school-based health centers forward, it was the same kind of thing," and she was referencing the King Middle School discussion a few years ago. Locally, and this sounds like Amanda, it was quite a hoop-de-doo when we first wanted to have school-based primary care services. People were coming up and putting their finger in my face, and then we worked through it, and we started the service, and it was a wonderful service, and everybody loved it. Now, I'm sure that kind of thing would be national news immediately. This provides a small snapshot of the amazing person Amanda was. She was always doing right by the student and making sure their needs were met, whether it was her taking the student to a doctor's appointment, just to name a few. Getting a student a much-needed wheelchair or starting an eyeglass fund when the state funding was reduced, just to name a few. Amanda would have been embarrassed a bit about the dedication of the clinic and her name, but I also know she would have been honored very much. Amanda did what she did not for the thanks, but because she truly cared and loved our students. Thank you for this fitting tribute to such an amazing person.
I would like to formally introduce our former Speaker of the House and Attorney General and Amanda's husband, Steve Rowe, and their daughter Lindsay to say a few brief remarks.
I'm Lindsay Rowe, Amanda's daughter, and anyone who knew anything about my mom knew that she was first and foremost a fierce advocate for children. She devoted over 30 years and countless hours outside of the workday during those 30 years to making sure that the children of Portland were both healthy and safe. She knew that school-based health centers were an important means to achieving this, which is why she was one of their earliest and greatest supporters. She would be so pleased with the opening of this newly renovated school-based health center at Portland High School And although, like everyone is saying, she would never have wanted the attention of having something named after her, it means a great deal to Dad and I that Mom's being honored here today and that her legacy of keeping children safe and healthy lives on. And I think that if something was going to have to be named after her, even she would have to smile and agree that this would be most fitting. So.
I want to thank Lori Gramlich for proposing this idea. I want to thank all of this, Mike Brennan, the mayor, the city council, the school committee, the superintendent, everyone, Sarah Thompson, everybody had anything to do with this. I want to thank all of you for coming today. I look across and I see most everybody here knew Amanda and worked with her, and we don't have to say it. I knew I was going to do this a lot better, but Michael was right. Amanda did say that. She did say that she couldn't get me to do anything, but she did say that. Michael was telling you the truth. It just wasn't true what Amanda said. I was carrying a lot of water for her up in Augusta over those years. She just wanted more than I could carry, and so she had to see Michael. And so Michael was on. He was the chair of the education committee, and she sought out a lot of people. Amanda, as you know, she was a strong advocate for kids' health. And I know that one of her favorite sayings was to bring about justice, deal with what's in front of you. And this is about justice. This Student Health Center here today, it's about economic, social justice. It's about all kinds of justice for kids who otherwise wouldn't have access to health services. Amanda always said that healthy kids learn better. Healthy kids learn better. And if you're not healthy, you're really not going to learn. And the only way a young person realizes his or her human potential is by being healthy. Good health equals realized human potential. And as we walk through here later, you're going to see that this isn't just about what we call physical primary care. It's dental care. It's also about behavioral health, mental health. It's in the integration of behavioral health and mental health, because as Amanda knew, that health is about your overall well-being. It's not just the absence of disease or injury. It's overall well-being, your social, your cognitive, your emotional, your physical well-being. And children don't learn, and they can't, again, realize their potential. This is what Amanda knew, and this is why she worked so hard to care for kids. We're just so proud of her for what she did, and this is it's an honor and it's a great tribute to her work. But she wouldn't want us talking about her. She would want you to go through here, look at this, and she would want you to support more of these, and she would want you to support health insurance for low-income people in the state of Maine. I know she would. So thank you all very much.
Feel free.